Now, Executive Suite with WPRI.com reporter Ted Nesi.
It may be hard to believe, but at many hospitals, doctors still use pagers. A Providence startup thinks it's time to change that. The company, CareThread, has developed technology allowing hospitals and physicians to communicate securely on iPhones and other popular devices. Last week, investors poured $750,000 into the company. This week on Executive Suite, CareThread CEO Dr. Scott Guelich. Plus, more than 1,500 students are left out in the cold after a local for-profit school shuts its doors without warning.
They had me sign the very last day. I don't know if they knew by then, but I signed my life away. I'm $22,000 in debt. Where do I go from here?
What went wrong at the Sawyer school, and what does it say about the for-profit college sector? We get the case for caution from the president of Rhode Island's Association of Independent Colleges and Universities, Daniel Egan. Welcome to Executive Suite. I'm Ted Nesi. Scott, I want to thank you for joining me.
Thank you for having me,
Our
Ted.
first new show of the new year, and here we are. I'll start off with good health for everyone. So, as I said in the open, doctors are still using pagers. That is astonishing to me. Why are doctors still using, most of them still using pagers, and why?
They are.
They must be the last profession.
Yeah, and actually, USA Mobility, the largest nationwide paging company, still a public company, and they put out your annual statement to investors every year, and they've seen their market shrinking and shrinking, and the thing that's staying solid is healthcare and some disaster response as well. But $250 million still spent just for USA Mobility and American Messaging, the leading two nationwide paging companies every year. Lots of smaller providers as well, and doctors are still using them.
Is there a reason? What would you point to as why pagers clearly haven't lasted past BlackBerries and iPhones in the investing world and other places?
Right, and BlackBerries, you have seen some growth of BlackBerries in healthcare, but certainly the way that RIM is headed right now, there's some uncertainty there as well, of course. And I think there are multiple factors. There's some degree that I think doctors like only having to be able to call someone back. That's one thing that pagers give them. But a lot of it is also that there's just an inertia within healthcare, and I think that's the most important thing, is that healthcare still has really old technologies that are used that when you look at other industries, it's shocking, the contrast.
Things move more quickly, maybe. So why can't doctors just use text messages like everybody else?
So there are security concerns. There are some security issues with pagers as well, but certainly over 80% of physicians have smartphones, more on iPhones. Android certainly is popular as well, and some BlackBerry as well. But there are some security issues with sending patient information via your smartphone, because if you're sending it via SMS to another provider, then that information...
SMS, short messaging service,
right,
basically what we think of as a text.
Yes, so when you're texting, the messages are going via SMS. So when those messages are being sent back and forth, though, they're not just going over the network, they're also on the device, the person who sent it, the person who received it. And if someone's device then gets stolen or lost, that has patient information on it, and that has to be reported, and that's considered a breach. Hospitals can get some cases 7-figure fines for losing laptops or mobile devices as well, and that's a big deal, and there's an increasing pressure actually from the federal government as well to improve patient safety, patient privacy around HIPAA and HITECH being the main acts. As of 2012, there are now random audits of institutions. 3% of institutions each year are now audited to make sure that they're keeping patient information
So
safe.
a lot of pressure on them for that. HIPAA, of course, being the big Privacy Act in healthcare that, that everyone knows you sign away your
and
HIPAA
HITECH is
guidelines.
kind of how you take care of that in technology.
With how Congress has come in. So you saw this. You're a doctor yourself as well. You worked in software as well prior to this. You've had a couple hats on. So where does CareThread come in, this company that you've co-founded? What do you see as the opportunity there, and what are you guys trying to do?
Sure. Well, the simplest thing we do is enable folks to replace pagers with a very secure and more powerful solution that works on mobile devices and web browsers. But we actually have a suite of technology that goes even further than that. And the key thing that sets us apart from some of our competitors is we integrate with the hospital systems, and we really leverage their technologies. And that lets us know who the providers are, as well as who the patients are. And then we can actually keep track of who the care teams are. And that's really important for collaboration and teamwork, is knowing, hey, for patient Smith over here, who's the nurse, who's the doctor, for patient Jones over here, it's a different set of providers. And knowing in real time who the nurse, who the doctor is, who are the consultants is really important for care coordination. Then we go even further to do some real-time clinical updates and shared tasks so that everyone can stay on the same page.
And with bringing people together, that's interesting. On your website, you called it care team mapping. Map out who the various nurses and doctors and others who are involved in this patient's care are. It sounds like it fits in with the broader push we saw in the healthcare reform law and others to get more, to have doctors talking to each other on different shifts, to have different institutions talking to each other. Is this part of that broad push you see in healthcare to have more coordination?
Absolutely. Care coordination is an increasingly important phrase and just increasingly important focus within healthcare right now. And that expands across the entire healthcare spectrum. We're starting within hospital systems, but you know, it's really interesting that folks on the same care team, even within the same building, often don't know who else is taking care of each of their patients. It's really hard for them to extend that conversation out to the primary care doctors and the other folks across the healthcare spectrum. We really need to make it easier for folks to know who else is taking care of the patients and collaborate better. So
let's, before we go to break, I want to give people understanding. Let's say I'm a doctor, my iPhone buzzes because of CareThread. It's like an app on an iPhone, for example. It would just be another app there. What am I seeing? What am I looking for? What information can I find there?
Well, first of all, if you just got a buzz, what you'll see on the home screen, you will not actually see any patient information because, of course, that would not be secure.
Right.
So you'll have to swipe into it. And the one thing that we actually enable hospitals to do is to allow folks to use their own devices. There's this push towards bring your own device, BYOD. And so CareThread itself is secure authentication on our app. So we can leverage their existing usernames and passwords and allow them to set a secure PIN for faster access because it's a mobile device. But then once you've authenticated into the app by entering your PIN, you can then see that message that the person has sent to you. And more importantly, you can also see the priority. You can respond right there with a pager. You can't do that. You have to go find a phone or a computer to send a text message to another person. But you can respond and have a conversation, a dialogue right there. And you can even see when your messages have been read, which is important as well.
So would it be maybe a nurse sends it, says, you know, Ted's taking a bad turn, what should we do tonight for him, or something like that?
Absolutely. And then the doctor can respond and send message
you
to
hope
the
the
nurse.
Goes pull the plug on Ted, yeah.
Hopefully not.
Hopefully not.
As well as even just, you know, we have some predefined messages, we call them quick texts. One of the most popular ones we expect is, where are you? I need to talk to you. A lot of medicine still happens face-to-face,
Sure.
But knowing who you need to talk to and where they are and how you can meet to discuss something is also very important.
Interesting. All right. Well, we're going to take a break. When we come back, we're going to talk more about CareThread and how CareThread came up through the Providence technology startup world that's burgeoning here. Stick with us on Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi. My guest here on the first half is Dr. Scott Guelich. He's the co-founder and CEO of CareThread, a Providence startup that has a new system to get doctors and physicians to talk to each other. They can use their iPhones instead of the pagers that many of them are still using. And we were talking in the break, Doc, about the investment you've had. First of all, I want to get to that first. I said $750 in the open, but it's a little more complicated than that. You're en route to $750,000.
Right, it's a $750,000 round. What was announced is $250 from Slater, of which we're really happy to be working with this Rhode Island-based investment firm and Thorne's Department there as well. We have additional investment as well, but what we've done is close the first half of a larger $750,000.
Got you. And how important is this new investment, even at the smaller size than what we said at first? Will it allow you to build and grow? Is that what you're looking for right now?
Absolutely. So our first focus will be to grow our engineering teams to be able to support folks as they come on, and then of course sales to be able to bring more hospitals on as well.
So, and let's talk about more hospitals in the addressable market here. I think that you have a huge potential market because everyone who needs to communicate with each other in the healthcare world could have view this. How big do you see the opportunity, and then how do you get into hospitals? How do you get doctors and hospitals to actually choose CareThread?
Sure. So the market itself is certainly large. There are over 5,000 hospitals nationwide, and you know, right now, as I mentioned before, $250 million is spent just on pagers, but that's just for doctors. Nurses often don't have communication devices, and the other auxiliary staff, it's actually therapists, social workers, case managers, and so forth, often do not have messaging solutions. So getting everybody onto the CareThread or onto any type of communication platform can grow that quite considerably. As far as the sales cycle, It can be long, and certainly within healthcare, it can be challenging. The thing that's really in our favor right now is this increased pressure from mobile devices. Bring your own device, compounded by this increased federal pressure for making sure that patient information is being kept safe. So there are usually only a handful of priorities that hospitals can afford to invest in technology-wise each year, and bring your own device and mobile messaging is percolating to the top, which has been helpful.
And do you encounter any resistance? As you said, doctors might like the pager because it at least keeps them a little arm's length from this availability. How do you address that with your fellow doctors?
Right, and that's one of the reasons why, for example, folks don't just give their cell phone numbers out to each other and do SMS. With CareThread, they still can be off. They're not giving away their home phone number, but they are actually, especially because we do that care team mapping, it's actually far more efficient. It's a lot easier to see at a glance who it is that you need to send that message to be able to do predefined message, to get prioritized messages when you receive it. We focus strongly on trying to make this as efficient and powerful for the providers as possible while still meeting the needs of the institution.
So you came through, CareThread came through Beta Spring, the startup accelerator. It's gotten a lot of attention here in Providence. We've had those guys on Newsmakers as well as here. And I'm curious first how important a role that played in letting you build this up, and how would you recommend that process to others who are interested in being entrepreneurs?
Oh, absolutely. It was critically important. There were 3 of us who ultimately founded this company, and none of us have extensive experience founding multiple other companies in the past. We understand our product space really well. We understand technology really well, but getting connected up with both the mentors who run Beta Spring, but also they have a broad mentor network of folks with a lot of business expertise, some have become formal advisors for us. That's been critically important for us, so that we essentially are going into this with a whole team of folks that are supporting us. And
have you found it hard at all to start a new business in Rhode Island? Just think about the headlines. We're always hearing about it as a bad place to do business. What's been your individual experience with CareThread? How's it been to start something new here?
It's been great, and certainly Beta Spring has been a big help. They've worked with Providence and some of the other City of Providence and other folks to kind of help support local companies. And there really haven't been any drawbacks from being here. As we get money, we're going to have to go out and recruit and hire talent, and finding good engineers is challenging across the nation. We're going to be competing with some good other high-tech companies here in the area, but you know, there's nothing unique about Providence here, and we're looking forward to growing here. And is there anything that could be done, whether it's by private groups like Beta Spring or the state, that could make it easier for entrepreneurs from your experience, or is it pretty much things are in place now in the right way? I think it'll be interesting seeing how Beta Spring and the Founders League, as that they're rolling forward, will continue to grow. I think there are 3 things that are really critically important for startups. One is community. It's a kind of a crazy thing to start a company and get one off the ground from scratch, and being in a network of other folks who are all have experience going through that process is critically important. Investment and talent are the other key things. So the more that we can actually build a startup community here, the more it'll actually attract investment, the more it'll attract talent, and the more that we will get that network effect. Yeah. Well, a good note to end on. I want to thank you, Dr. Guelich, for being here. That's all the time we have in this segment. After the break, the collapse of the Sawyer schools raised a lot of questions about for-profit schools. We're going to talk to the head of the Nonprofit Schools Association here in Rhode Island about his concerns. Stick with us on Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi, and I'm joined now by Dan Egan. He's president of Deep Breath, the Association of Independent Colleges and Universities of Rhode Island, ACU, we sometimes call it, representing the nonprofit private higher education institutions in Rhode Island. Dan, thanks for being here.
Thanks for having me, Ted.
Good to see you as always.
Same here.
So what do you make of what happened at the Sawyer School?
Well, the Sawyer School situation is obviously really unfortunate for the students. It is different, you know, the for-profit Sawyer model, which is is not an accredited association like institutions which gives degrees that I represent. So they're non-degree granting. So it's a little bit different, apples to oranges. Certificate programs. And there's a real important space for that and a place for that for students in Rhode Island and across the country. what we believe, though, is it really is a cautionary tale to the for-profit model and what potentially can happen. And unfortunately, it happened in a very dramatic way here in Providence at the Sawyer School.
That's what I wanted to have you on. You've been raising the alarm bell about for-profit schools for a while. You and your organization was opposed to Newmont University last year that proposed coming into Rhode Island. Is this what you've been talking about? Is this, students left in the lurch with debt and without certificates in this case? Is that what you were concerned about?
Absolutely. Unfortunately, it's an alarming trend. And if you look at Congress has acted on it. Senator Tom Harkins from Iowa did a report this summer out of the Senate Health, Education, Labor, and Pensions Committee, of which Sheldon Whitehouse in Rhode Island also serves, and really looked at the sector. It's a sector that had $3.6 billion in profit last year, and yet only spent $3.2 billion on instruction. It's a sector that's income or income generation is pretty close, if not 95 or 90% or 80% of its federal intake of federal dollars. It makes up their profit. So it's a different model than what the nonprofit model in Rhode Island and the public-private partnership we've created over the years has been established on. So we have concerns about the impact it has on students and the quality control that goes into it.
Now, let me push back at that, because there's for-profit schools. There's obviously a demand there, at least for what the students thought they were going to get. In the Sawyer School case, that woman we heard at the top who's taken on $22,000 in debt, she wanted an education and I assume a better job. They were willing to pay. Is that a sign that the rest of our higher education system isn't providing what these students think they need?
There's clearly an open space in that middle ground of some education. The President Obama's charge for 2020 to increase the graduation master's or bachelor's degrees is important, but there are some people that just need some education and not a total degree. The question is the quality there? Are we providing people, and do we have situations where the people are going to be set up for success? Given that some of these institutions are driven by the financial model, and so costs are important, cutting corners are important. They're typically not of this area. Our institutions are all based here. They're homegrown. These institutions are fly-by-night in some cases. So the ability to regulate is very difficult. I think in light of Sawyer, there's probably an opportunity to relook if regulation should be increased, particularly on that. There are places, and there are opportunities in the nonprofit sector, whether it be you look at those that have stepped up, New England Tech, Roger Williams, to help those students. There are places where that type of programming can happen, and we stand ready to effectively try and do that. But regulation in terms of strong quality control would be really important at this point, I think.
Talking about regulation, the Board of Governors of Higher Education is being messily merged with its K-12 counterpart into one big Rhode Island Board of Education. Process has been heavily criticized as sloppy. They're now talking about extending it and waiting. But what are your thoughts from your institutions are under the Board of Governors for Higher Ed, now the new Board of Ed potentially. What do you think of that? Do you think it's going to work? And what are you looking for as they set up the new board?
Well, one of the things that we were willing to or ready to talk to as the new board got underway was the for-profit coming into the state and what that meant. Sawyer clearly is going to put that right in front of them as they form themselves. The state has had that structure before. Other states have that structure where they've merged. We hope that there'll continue to be thoughtfulness. The governor's put forward some solid names to make that happen. But we really would be pressing on them and pushing them to think about the for-profit, and particularly the different for-profit than we've talked to in the past, and that would be the non-degree granting ones like Sawyer.
And let's go back to your schools and what you were talking about. You've said to me before, when we've been talking for stories, that there's an opportunity for growth, your members think, in continuing education, in degrees for non-traditional students. Where do you see that bubbling up, and is it going to be cost effective for students? People can't necessarily pay $200,000 for a degree, especially as an adult with a family.
Well, it's funny, the continuing ed programs that we've worked a lot with over the past year in our association to work on collaborative efforts to do things more effectively, currently, including the three publics, I think educate more than 5,000 individuals in the state of Rhode Island. Those programs really educate Rhode Islanders in a strong sense in an active way. There's opportunity there to do that more effectively, and we've begun to do that talking to each other. So we can do it, and we're placed in a position to do it, and we have all of the resources to do it, to go forward and do it successfully.
And with Sawyer and the for-profits, I mean, is the core concern about that they're making a profit? Is it that, you know what I mean? Is it just that they're not non-for-profit and they're honing into the marketplace? I mean, what's the heart of the concern?
For not Sawyer, but our competitors, Newmont and the Austin School and others that have come in and asked to come in, Rhode Island has a social contract, a public-private partnership that's been in existence for over 50 years. You know, in the debate, we've had the conversation, some people, including yourself, thought some of my schools were for-profit. And they were, in fact. In fact, 4 of my 8 members were for-profit 50, 60, 70, 80 years ago.
What caused the change?
Well, of course, the change was a public policy shift in a social contract with the state of Rhode Island. So the public-private partnership now allows for the state of Rhode Island to have 11 robust quality institutions delivering education to 88,000. If you look at states to the far west that don't have that network of independents, that don't partner, the burden of higher education falls on the state system alone. So one of the benefits for the state is the state can fund and do its activities around its 3 institutions, which do a terrific job, but then we are able to augment that with 8. So recognition of that, I think 30, 20, maybe 20 years ago, recognition of that partnership and protection of that partnership, I think is why that legislation is required for an institution to be granted the ability to grant degrees, has to go through the State House and then the Board of Governors as well. And I think that's recognition of that social contract.
I've got to ask, we always talk about student loans and debt. Your colleague Adam Leonard has often said he sees a lot of, if not misinformation, misguided reporting and information coming out on that question as students. The big cases get a lot of attention, but for a lot of students it's manageable. I mean, what's the conversation like right now inside institutions like yours about where debt levels are? Is there high concern? Do you see any changes coming? Do you think it's all overblown, the concerns about it?
I'm not sure it's all overblown. I think what happens, though, the media tends to look at the outliers and the sexy stories that tend to really get people up in arms. And there are some serious situations where people have gotten into places where they shouldn't be financially for debt for a number of reasons. Our institutions, fortunately, have a lot of systems in place. What we've done on the costs and the loan issue is we really tried to focus as an association on ways that we could collaborate to cut our own internal costs, therefore passing that on to our students and their families. Clearly, the last 4 to 5 years have been very difficult for institutions. It's been difficult for everyone financially. And it's really hit an impact on student spending and family spending, and really looking on how they're going to afford that. And our institutions have really stepped up, and we've increased our financial aid programs across the board dramatically in that period to help families afford it. So we're conscious of it. We do things collaboratively and collectively to try to effectively lower our own costs and pass that on, and at the same time afford programs and provide programs for families to afford the ability to really, you know, at the end of the day, a college education is really a huge stepping stone, and still is a huge part of the American dream, despite what this recession has made it seem in the past 4 to 5 years.
We only have about 15 seconds left, but how much bitterness is left at the city of Providence after they muscled your members for some more money?
Oh, there's no bitterness at all. I think we accomplished what exactly the mayor set out to, what the presidents have set out to, and that was have a transactional relationship where mutually beneficially each institution in the city helped each other grow, and I think that's exactly what the mayor and the presidents did.
Think Tavares will get any honorary degrees?
I don't bet on that. I don't advise my presidents on that, so I'll stay
out of your
one.
wheelhouse, right? All right. Well, surprise question there to finish off on. That's all the time we have this week. I want to thank Dan Egan for joining me, and I want to thank CareThread CEO Dr. Scott Guelich, who was there in the first half. If you missed any of the show or want to catch up on any episodes, they're all on our website, WPRI.com. And we'll see you next week here on Executive Suite.